Let's be honest, when you have multiple sclerosis, you have a lot on your mind, and likely you are experiencing a ton of different symptoms. So it's really easy to forget the specifics about what you're dealing with on a day-to-day basis. But it is extremely important that when you go to your doctor's appointments, no matter if it's with a neurologist, a primary care physician, a physical therapist like myself, it is so important that you remember the specifics about your symptoms. If you can't remember your symptoms and you're being really broad or generic with what you're telling your practitioners, it's really hard for them to treat you in the best way that they can because they don't understand exactly what you're going through or what you're feeling. So I made a note of 7 things that I want you to make sure you tell the next doctor that you see at your visit, and I want you to write down specific things. So I actually wrote down for myself, so I don't forget what to tell you, these 7 things. And right now, I want you to take a break to grab a piece of paper and a pen so you can write these things down, so that when you go to your next appointment, you can bring it out and review exactly what we're going to go over. My name is Dr. Gretchen at The Missing Link, and I created this YouTube channel so that I could help as many people as I can with multiple sclerosis throughout the entire world, not just the area that I am currently treating in. I hope you find my YouTube channel inspiring and educational, and that you are motivated to keep up the good work and keep moving. The first thing that is really important that you talk to your doctors about is fatigue. If you're not dealing with fatigue, then you can move on to the next one. But fatigue is one of the most common symptoms that people with multiple sclerosis deal with. And it's really important that you don't just say, I feel tired or I feel fatigued. I have an entire YouTube video that is dedicated to explaining the differences between primary fatigue and secondary fatigue. But not only is it important to know what type of fatigue you have, but your doctors need to know what it feels like. And not only that, when do you feel fatigued? Is it in the morning, the afternoon, the evening, all day long? When are you feeling fatigued? And what makes it better and what makes it worse? If anything. Sometimes there is nothing that makes it better and nothing that makes it worse. There's nothing you can do. It's just there. But if there is something that makes it better, maybe exercise, maybe going out for a walk, maybe a conversation with a friend, if there's anything that makes it better, medication, that is something that's noteworthy. So write those things down right now. And if there's anything that makes it worse, if there's nothing that makes it worse, that's likely primary fatigue. But if being out late means you are swamped the rest of the day, you have nothing else that you can do because you're so tired, that would be a reason. If you exercised and maybe it was only 30 minutes of exercise, but the rest of the day and maybe even 2 or 3 days afterwards, you just can't move, you're so fatigued, write that down. And also write down what it feels like. Does it just feel like you're tired, or maybe really tired, or maybe it's so fatiguing that you have a difficult time opening your eyes just to see the world around you? Write down as many descriptive words as you can think of to explain your fatigue so that your doctor can get a good idea of what you're actually feeling. People who don't have multiple sclerosis do not understand what fatigue feels like from someone who does have MS. So it's really important that you explain this not only to your doctors, but also to your loved ones. The second thing that I want you to write down is your frequency of falls. And hopefully you're watching this and you're thinking, oh, Dr. Gretchen, I haven't fallen at all this year, so I'm good. If that's you, then go ahead and skip on to the next one. But the frequency of falls is very important. How many times have you fallen in the last 6 months as well as the last year? Jot that number down. The reason I want to mention this is because a fall is often thought of as something where you fall heavily to the ground. But I want you to know that a fall is also a fall if you had a slow control fall and maybe you actually landed on your butt, but it was no pain, no injuries, it was nice and controlled, but you still land on the ground. That is still a fall. You need to count that as a fall. Or if you leaned against a wall and slowly slid to the ground, that is still a fall. Anything where you end up on the ground, slow or fast, is considered a fall. So make sure you write that down. Additionally, near falls is a huge indicator of how you're doing physically and how your balance is, how your walking is. So a near fall is something where you almost fall, but you caught yourself. So maybe you are walking and you tripped. Maybe you were just standing reaching for something in your closet and you almost fell, but you caught yourself in the closet on the wall. Whatever the reason is for you catching yourself, it's still considered a near fall because you almost fell, but something caught you. And that is a really important number to write down. A good example of this is a client I recently saw. I asked her how many times she fell in the last year, and she said just one. So my initial thought is, okay, ideally 0 falls would be better, but 1 fall isn't the worst. But I then asked her, how many near falls do you have? And at first she said, none, I don't fall at all, just that one in the last year. And I rephrased it and I said, well, how many times did you almost fall but you catch yourself? And give me that number, whatever makes the most sense for you. How many near falls did you have in the last week, in the last day, in the last 6 months or a year? And it's different for everyone. But this woman said that she has a near fall 4 times a day. So that puts a very different image in my mind. And as a physical therapist, we are going to have a very different treatment plan if I know you're having near falls frequently versus never. So make sure you're mentioning falls and near falls to your doctors. The third thing I want you to mention to your doctors is pain. This is another really common symptom of multiple sclerosis, but you need to mention not only that you're having pain, but where is it? How long does it last? And what does it feel like? If you have pain every now and then, maybe aches and pains from arthritis, or you had a fall, so you have a pain from that, that's very different than constant pain that's burning, and sometimes it feels like numbness and tingling, and it's in your legs all day long, all week long. It's very different. So mentioning the type of pain that you're feeling, the frequency of how often do you get it, and how long does it last. Also make note if there is anything that makes your pain better, makes it go away, or anything that makes it worse. Spasticity is another really common symptom of multiple sclerosis. So if you suffer from spasticity or rigidity or tightness in your muscles, that is not only something you need to mention to your doctors, but it is also something that you need to understand what it's preventing you from doing. So when you're talking to your doctors and you're saying, I have a lot of leg tightness, not only should you mention where, hopefully you're able to feel where it is. Is it in the front of your legs, maybe the hips? Is it behind your knees? Is it in your shins? Where is your tightness? But also, what is it preventing you from doing? Does your tightness prevent you from bending your knee when you're walking, and therefore it's affecting your walking? Or does your tightness prevent you from lifting your leg up, so therefore you have a hard time getting into bed or getting into your car or climbing stairs? What types of things is your spasticity and tightness preventing you from doing? This again paints a very clear image in our minds of not only where is your tightness, but also how bad is it? Is it not preventing you from doing anything and you can do anything that you want? Or is it limiting your day-to-day activities? If it's limiting you, we're going to put that higher up on our priority list than if you say you have tightness but it's not bothering you. So make sure to note that. The fifth thing that I want you to pay attention to is your balance. I can't tell you how many people come into my PT office and they will say, Dr. Gretchen, my balance is bad. That's one thing I want to work on. And balance is too broad. While some doctors may accept that, I don't think that's a good enough answer. So I try to pry a little bit more. When is your balance bad? Is it when you're walking? Is it when you're reaching for something? Is it when you're just standing around? All of these are different types of balance, and it's really important to know when your balance is bad. And if you're listening to this right now and you're saying, my balance is okay, I would ask you, do you ever use your furniture as you're walking around your home? Or do you ever use your walls as you're walking around a doctor's office or your home or anywhere? If so, that is an indicator that your balance isn't great. I'm not saying it's bad, but it does mean that you need to work on your balance. So paying attention to when you need support, such as furniture or walls, as well as when your balance isn't ideal. Those are indications that we need to work on your balance in those specific environments. And it's a very different picture than just having bad balance. Bad balance, there's a ton of different exercises we can do, but they aren't going to be functional, and therefore you won't improve as much because it's not the same situation or the same environment where you're actually having the difficulty. The sixth thing that I want you to think more about right now is your walking. 9 times out of 10, when I'm working with someone with multiple sclerosis, they will say, Dr. Gretchen, I need help with my walking. I want my walking to be better. And while that might seem like a good goal, there are so many different things that make up walking. Walking is not just this one thing. Walking includes strength, it includes balance, it includes endurance, it includes so many things, and it's important to know what is challenging you in your walking. If it's strength, you'll feel weakness while you're walking. It's hard to lift your leg up. Or if it's because of tightness, it'll be hard to move your legs because of that spasticity. Or perhaps walking is challenging for you because of the balance. You lose your balance when you're walking forward or sideways or backwards when you're going to sit down. Or maybe your strength and your balance is fine when you're walking, but your endurance isn't great and you have difficulty walking for a longer period of time. So asking yourself these questions of what is challenging for me about my walking? What makes it hard? And it's a really tough question. You might not know the answer right now, but start thinking in that way so that you can talk to your doctor about this. There are a lot of different walking exercises, but the best ones are going to be functional for you. Meaning, if it's balance, you practice balance in walking. If it's more of a strength issue, you practice strengthening while walking. There are different ways to make these exercises best for you, but it's impossible to do that if we don't know exactly what you're dealing with. The 7th thing is my favorite thing. It's goal setting. And some of the goals that physical therapists make are very clinical. For example, I might make a goal that your hip flexor strength is a 4 out of a 5 because it's starting at a 2 out of a 5, and your hip flexor strength will mean that you're improving your walking. But my favorite type of goals are functional, meaning they are activity-based. So before you go and see any of your doctors, I want you to make a list of the things that are challenging for you to do around your home or in your community. Typically, when I ask my clients what their goals are, they will say walking and balance. And that is great. I can pry a little bit more and make some exercises for that, but it's really helpful to know how your symptoms are limiting you throughout your day. So what types of things are hard for you to do in your home or in the community? How about climbing stairs? Is that a challenging task or not? How about getting into or out of bed? How about putting your socks and shoes on? How about getting into a car? Anything that you do throughout the day that's even slightly challenging, if you want it to be a little bit easier, then that should be a goal. And all of these goals can be broken up into so many different exercises. So really think about what types of things are hard for you to do or a little bit challenging that you want to be easier, and write them down, bring them into your doctor's office. It could even be something like standing up from the ground. If you've fallen, you need to be able to have the strength to stand up off of the ground. But also if you're on the ground stretching or playing with a kid, whatever the reason might be, if it's hard for you to stand up from the ground, that is something that is noteworthy that you should be mentioning to your doctor. Or if you're noticing a more difficult time walking around in the grocery store or walking into a store, anything that you're doing that is a little bit challenging is worth noting. So make that list right now of all of the things you can think of that you want to be a little bit easier in life. These 7 things are so important. No one knows what you are going through and what you're feeling better than you do. So write these notes down, bring them into all of your doctor's appointments, and help us help you in the best way that we can. Thank you so much for taking your time to watch this video. I hope you found it valuable. Please remember to press the subscribe button, press the thumbs up button, and share with a friend. And if you have a couple extra minutes, check out some of these videos.